The pandemic's been really interesting because we've seen a bunch of things. I think across the state, we've seen some of the deficiencies in our local public health infrastructure. New Jersey is very much a home rule state. Every town has its own health department, right? Or, there's some collaboration, but those aren't really designed and coordinated to respond to a global pandemic. So we've had this New Jersey's overall deficient public health infrastructure. What we've been able to do in Trenton, we've really only been able to do because of the collaboration among the health department, government, local government, county government, and the healthcare institutions. So since March of last year, we've convened a morning call with executives from the hospitals, the health center, the health department, the county, their schools are on it now. In the beginning of the pandemic, we were meeting 7 days a week, every single day in the morning saying, all right, what's going on today? What do we need to do? What do we see in the data? What are the challenges we're facing? It's like 20 or 30 minutes, but it keeps everybody on the same page. We're still doing that Monday, Wednesday, Friday. We had one yesterday. And now the focus is around, of course, the vaccine rollout. How do we address the equity issues in the vaccine that we're still seeing? How do we deal with all of the challenges with the reliance on digital modes of accessing the vaccine? You really, for the most part, have to be able to get on a web page. So all of that kind of stuff. We've been able through we have our own data scientists. We've been able to really highlight, even back to March, where is the pandemic disproportionately impacting Trenton? We saw in April and May of last year, we had positivity rates from testing of more than 60% in some of the areas of South Trenton. That was by far the hardest hit, where we were really seeing a disproportionate impact of how COVID was impacting even the 7.5 square miles of the Trenton community. I can give some general answers, but there's a lot of nuance in these. And I think that's one of the challenges in understanding these things is we have to keep kind of unpacking the nuance to really understand why. For Trenton, for at that time, we were really seeing, that's a large part of the Spanish-speaking community in Trenton. That part of the community has less access to the digital media, particularly English language digital media that was spreading a lot of the information about COVID and the importance of the preventive measures around COVID. Lots of multi-generational households, lots of residents who were employed in kind of hourly direct service jobs that didn't have the ability to work remotely or were concerned that they didn't have the same access to job protections should they become infected. So a lot of kind of compounding factors there. Black and brown communities are impacted a lot harder than white communities overall. And Black and brown communities in Trenton have been impacted harder than Black and brown communities in communities that may have more resources. The first thing that we really try to do is make ourselves available to all of the on-the-ground community organizations, community groups, people that are already in these communities. It's not our place to try to go into a community all of a sudden in the pandemic. We have to have been here all along. And communities within Trenton, whether it's a faith-based group, whether it's a sorority or fraternity, whether it's a neighborhood association, whatever it is, these groups already exist and communicate with each other, know one another. And so we need to make sure that we take our resources, our access to physicians, our access to accurate information, our ability to have a conversation about, wait a minute, what is this whole vaccine? And I've got these concerns about it. And we need to create opportunities for those conversations that are already happening within the community to have access to the resources to get accurate information. That's by far the most important thing. In terms of spreading knowledge about how to protect ourselves from the pandemic, we really look to take voices from within our community and give them a bigger platform to share their stories. We worked with some patients who had been treated at Henry J. Austin Health Center who had COVID or a family member with COVID, who shared a little 30, 45-second video of what their experience was. There are a lot of very valid reasons why communities of color, particularly the Black community, distrusts medical research. We need to own healthcare's long history of inappropriately experimenting on Black bodies. We need to own that. We need to be able to have conversations around what that history is. We need to do the work to be able to not just make some data available, but to go all the way back to who are the researchers in this study? Who is the IRB that approved this study? What's their background? And it's not just what's the color of their skin. How do they know? How do they have an experience that I can relate to? How do they understand me? How can I trust them? How can I know that they have asked the questions that can create the answers that each person can believe in? It's a really huge issue. In terms of the current rollout of the vaccine, it's one that we haven't pushed on quite as much yet because we're still in a place where the supply of the vaccine is so inadequate based on need. So we're in this really tough place where we want to have conversations around vaccine hesitancy, but then if we're able to share information with someone and they then become at the place of saying, okay, I'm willing to do this, we then want to be able to get them a vaccine. And right now, the supply is still so severely limited that we're in a really tough place where there's just this anxiety around, will I be able to get a vaccine? And I think it's really important that everyone who wants to get a vaccine ultimately will be able to get one. And all three of these vaccines are hugely effective. No one who received any of the vaccines in any of the studies was seriously hospitalized or died. So, we have tremendously good tools. We need to catch up with the demand and then be at a place where we can have these conversations around, what's your concern about the vaccine? Let us give you first of all, it's okay to have a concern, right? We need to not say, oh, come on, just get. We need to let people have a concern. We need to do the work to give them the information, and then it's their decision. We need to respect that someone's going to make their own decision for what's right for themselves. The state has specific rollout processes for kind of who got Pfizer, who got Moderna. Pfizer is the one that has the ultra cold storage requirement. So it tended to go to the larger hospital systems that had better ultra cold freezer storage. So Capital Health, St. Francis, Henry J. Austin, Mercer County have all been Moderna sites. Even there's a FEMA site going on last week and this week. It's also Moderna. We're just starting to see J&J coming to the supply chain. There may be some J&J vaccine given out in Trenton by the end of this week, but certainly next week, if not this week.
How effective is the Moderna vaccine?
These are all incredibly effective. I think so one of the challenges with, we hear this like 94%, 95% versus 80% or 78% or something. These studies were done at different times. So the variants of the virus that were around in the communities when they were being tested are different because the studies were done at different times. So we can't compare these one versus the other. We can't say this one scored a 95 and this one scored a 93, so the 95 is better. It's not accurate. The vaccines are all much more effective than we even hoped for in the beginning. The flu shot is about 40% effective depending on the year, and we all still get it. So I think we need to kind of make sure we understand these numbers well. And the real point of the vaccine is not to prevent getting sick at all. It's to prevent serious illness or death. And all of the vaccines are 100% effective at preventing serious illness and death.
Could you walk me through the process of getting the vaccine? What is the first thing someone needs to do?
This is where, frankly, I would say the system is a bit of a mess, but it's not even one system. So the first piece of advice we give to everybody is to register on the state's website, covidvaccine.nj.gov. They ask a series of questions, gets you into the queue in what's called the VSS, the vaccine scheduling system. Mercer County and Capital Health's vaccine site at the Cure Arena uses this process. The Capital Health Hopewell uses this process. So it's the first step. There are also a lot of other places where you can go and register to be on their own list to get the vaccine. Henry J. Austin started using the VSS system, but the VSS system only lets you filter by county of residence. You can't focus smaller than that. And Henry J. Austin's mission is really the Trenton community and other priority populations that don't have as much access to health services. So they've taken their own scheduling process in-house so that they can focus just on our community. But the state has a list of places you can register and register on all those websites. The state also has a call center, an 800 number, an 855 number. That call center, though, can only schedule in that VSS system. So it's still somewhat of a fragmented process. It's increasingly getting better. So I mentioned that there's a FEMA vaccination site in Trenton last week and this week. The registration to participate in that site actually came through local churches. There's some more targeted outreach being done to senior populations, 75 and over, starting to have work in some of the senior housing buildings. So we're getting there, but I think it's important that we acknowledge this has been a very fragmented process and one that requires accessing a web page and having an email address. And again, that's getting better, but that's what it's been to this point.
And what happens if you don't have that? What if you're not really technical? You don't know how to work in a computer or navigate through the site? Because you explained it to me, it sounds like an arduous process already. Or, what about the brown community and people who English may not be their first language?
Yep. So that was
in Spanish as well.
So that was one of the big motivations for the state to stand up their call center. They've got now more than 800 call agents, I think, in the call center. They speak Spanish fluently. So you can register, you can call the state, they can get you in the system, and they have a process where if you don't have an email address, you don't need one. Like they can set it up such that they'll call you back and support someone who doesn't have email. The state's website to register, parts of it are translated in Spanish and parts of it aren't, but we actually had a local Trenton organization, LALDEF, the Latin American Legal Defense and Education Fund, did screenshots of each page of it and translated the screenshots. And we've shared that around. So Michelle made that available. So, we're getting there. Again, more and more processes that the local health department has started to do, because we know that it is not equitable to have such a digitally focused process. So it's getting better, but for all of January and most of February, you needed a computer and email. Starting in kind of second half of February and moving forward, there are more and more ways for someone who doesn't have digital access or speak English to get on the list.
Is there anything that you want the public to know about the vaccine?
So first, Matt, about COVID in general, we've been at this for a year. Everybody is sick of it. We're almost there. So the first thing is don't ease up on all of the things that we've been doing all this time. Mask or even double mask at this point, where the surgical mask with a cloth one over it. Still do what you can to avoid the gatherings, right? Keep your distance and wash your hands. And about the vaccine, for someone who's been trying to get the vaccine to this point, they're probably frustrated. We're getting there. You will have your turn very soon. For someone who has questions about whether or not they want to get the vaccine, seek out accurate information to get your question answered. Don't trust random sources on Facebook. Go on Henry J. Austin's webpage. Go on the Trenton Health Team webpage. We're putting a lot of trusted information there so that people can have accurate information to make their decision on. The last thing we want to see is someone who has a concern have that concern heightened by information that's wrong. It's their decision ultimately. If someone says, I don't feel comfortable yet, I'm not ready, that is perfectly their right. But make that decision based on real information, not something that someone just decided to type into Facebook.